Hello and welcome. This is a new segment that is especially for CABI members, and I'm just going to call it Health Matters because it seems like that's what we're talking about. Because my guest today is Dr. Isabelle Grote, and I hope we're going to do a little series of these conversations together to help you learn more about what makes your body tick and also how to support yourself to be as healthy as possible. And what prompted the idea to do this is a wonderful booklet that Dr. Isabelle gives to her patients with all sorts of fabulous information. And I think before we go any further, I should allow you, Isabelle, to introduce yourself. So,
Oh my God.
hello.
Hi. You've done that already. I can't add anything to that one, really.
So you have the title of doctor, but you are not a medical doctor that we would
No.
see in the NHS. So tell
No.
us what kind of doctor you are.
I'm a naturopathic doctor, and I trained here in the UK, in Germany, and a little bit in Switzerland, and did some things from the in the States. So it was a training. A proper naturopathic doctor takes about 12 years to train. And we have, in comparison to others, we have to do about 72 hours a year of naturopathic continued professional training.
Okay, so that's good. Now we all know who you are and why you have this title of doctor. So because so much of health relies on what goes on in the gut, and I learned fairly recently the importance of what happens in the mouth in relation to the gut, I thought maybe we ought to start with the mouth. And can you maybe give us an idea of why oral health is so important in terms of our overall well-being and how it connects with the gut health as well?
It's a huge field, actually, and I think I'm hoping that I've got some illustrations here, which I'm hoping that you can see, and I will try and hold it up and see whether you can see this.
Okay, so
It's the connection of each tooth to a part of your body. Okay.
aha.
Through meridians and nerves. This is another nice one, which basically shows you that is your teeth with all the nerves that go from the teeth actually to the brain. Is there any way we can make that clearer for everybody? I don't know.
It's actually pretty clear.
It is. So you can understand whatever affects our oral health, our teeth will go into the brain, but also affect, because of the nerves. I did hold it up the right way around. No, I didn't. There you go. The organs.
Wow. Okay. Wow. That's pretty amazing, actually. It's not something that we are taught or that we think about. So there is a huge connection.
Yes.
So, okay. So we now understand that there is a big connection between what goes on in our mouths and the brain, plus other organs in the body.
Yep.
Tell us more. How does what goes on in our mouths impact on our health overall?
Well, it impacts all the enzymes, and I mean, the enzymes and bacteria. There is actually a beautiful German book I tried to find it whether it was translated into English, but it wasn't. And it says each tooth, a human hangs on each tooth. There you go. And it's quite interesting because also one of the things, it was published in 2000, and one of the things this dentist says is that Louis Pasteur, on his deathbed, admitted that it's not the viral, it's the terrain that is the problem. So if your terrain, i.e. your body and your gut, aren't working properly, then your immune system can't work properly, and you'll come down with various other things and be more susceptible to infections, inflammation, things like that. So it's really important to keep your mouth clean, or all that area pretty clean. But don't use fluoride. The best thing is really oil pulling, because oil pulling doesn't only affect the mouth, it affects the whole digestive tract. So what happens when you start oil pulling is, as you start pulling, your body goes, oh, we're going to have food. So this production of the saliva increases. And then the gut, it goes into obviously you don't swallow it, you're just oil pulling, but the messages from the brain is then, well, the stomach needs to get ready to start digesting the food. And what happens then, it's hydrochloric acid is the stomach acid. So it starts ejecting a little bit of the stomach acid, which cleans the stomach. Normally you'd have food in it then, and then it'll start digesting. But this way it just cleans the stomach, and it just goes down further down into the digestive tract, and everything else is expecting food, and all the juices, for want of a better word, are flowing in as well. So you're having a little cleanse before you actually have something to eat. I always suggest that you do the oil pulling before you have your meal in the morning, and you do it always on an empty stomach. If you only do it, I only do it once a day. If you're seriously ill, then you do it several times a day, because you need that flush several times a day. And it's very easy on the liver, because when you're ill, the liver and the kidneys they have real problems. So you want to be very, very gentle.
Okay, so I think we need to know what oil pulling is.
Well, you basically I prefer coconut oil, but you can do it with sesame oil as well. It's got to be unrefined, organic, obviously. You take a teaspoon and you swish it around in your mouth I start doing things, so often it's about half an hour. But in general, you can do it from 2 minutes to start getting used to it, to as long as you can cope with it. And then you spit it out and you brush your teeth. So obviously you don't use your fluoride toothpaste, or let's say conventional toothpaste, because they've got various other horrendous things in them. And if you look on normal toothpaste, on the actual tube, it will have a black box warning on it, which is nobody looks at these things. I don't know why I do. It's something I learned during training. Do you know that your toothpaste is actually it's like in one of the books, while I was looking around about thinking what we could talk about, it was also about the root canal treatment. And Weston Price, he's great. He was a dentist, had a fantastic book, and it's the root canal cover-up, actually issued by the Association of Root Canal Specialists, which is just amazing. And he says somewhere that he has actual proof that the people who invented the fluoride story, because it's a byproduct of various chemical processes, petrol production and various other things, said, oh, don't say fluor, just say fluoride, it sounds safer. And so everybody's fallen for fluoride. In actual fact, it's chemically produced synthetic fluor, which is a byproduct also of pesticides and insecticides and fertilizer. So I'm sure I've digressed again. Sorry.
So I'm going to bring you back now because you're talking about root canals. So we're doing so.
Well, no, it's just that the toothpaste, you need to be careful of the toothpaste.
Yeah,
and that was the reason why. Sorry.
So I'll come back to good toothpaste recipes, and perhaps we can put one in the description box. I'm sure that we can put one in the description box for everybody. But so we come back to so we were oil pulling, which is swishing the oil around, and you recommend coconut oil. I find it much easier to use coconut oil than anything else, actually. So there's coconut oil or sesame oil, you've said, but we're pulling oil because and that is acting as like a little bell that says dinner time to everything, and so it's kickstarting the digestive process before even started eating. Okay, so that's interesting. Can
I just interject there? Sorry, coconut oil is best because it also alkalizes the mouth. It has antimicrobial, etc. properties, and it does help the teeth to remineralize. Right. That's why coconut oil is the best.
So that brings me to the next thing, because there's a number of things that can go wrong and in the mouth. And I guess the first thing that can go wrong is plaque. So how can we deal with plaque if it's already there, or prevent plaque from developing?
Well, it comes after the oil pulling and then brushing your teeth. Now, what I use is, again, a little bit of coconut oil mixed in with bicarbonate soda. And if you want to put some essential oils in there, that's fine. Peppermint is a really nice one, or clove even, which really attacks everything else in your mouth as well. Wouldn't recommend oregano unless you're seriously ill, but yeah, it's if you have oregano oil on its own in your mouth, I can tell you from experience, it really burns your mouth to smithereens. It took me 3 days to get all the skin out of the not a good idea. So so the bicarbonate soda works against plaque as well, and various essential oils are also plaque preventatives.
So if somebody has already got plaque buildup and they're wanting to avoid, the scale machine at the dentist, is using this combination of coconut oil and sodium bicarb enough to clear the plaque?
Yes. Yeah, because the dentist I used to go to pre-COVID, he was going, oh God, really, we can't do anything with her. We can't even pretend to do plaque removal. So basically, we always had a chat. We just looked at my teeth and go, oh, okay, fine, off you go, bye. I tried to educate him in the more holistic ways of being a dentist. Fell on deaf ears, unfortunately, but never mind.
Okay, good. So,
but you can actually make a spray as well with colloidal silver and again various essential oils and a little bit of aloe vera, and that should remove plaque as well if you're already struggling with plaque.
Okay, well that's a good thing. So the other thing that can go wrong, of course, is something like gingivitis. So there's that inflammation of the gums. Talk us through what causes gingivitis, and then how can we deal with it?
Well, basically it's bacteria, not brushing your teeth properly, and yes, generally poor oral health and wrong diet. That is how gingivitis starts. Or if you, I mean, one of the other really big ones for gingivitis is chemotherapy. So some other drugs, some medicines can cause gingivitis. So that's that. Again, sprays with essential oils, but mainly oil pulling. Oil pulling, I've seen people with literally bleeding gums, teeth loose after 6-7 weeks of doing 3 to 4 times oil pulling a day, where they came because the dentist said we have to operate and we have to wire the teeth into the bone. No operation, didn't have to happen. So the oil pulling is really such a fantastic, something so small with huge effect. And I know certainly with my dad, he had bad, because he was not mentally unstable, but he had his mental health issues, and brushing his teeth wasn't really on his agenda that much. And I managed to get him sorted with oil pulling, but also with a mouthwash, a good mouthwash with clove oil, colloidal silver, and a bit of aloe vera, and a couple of other, black pepper, I think it was in there as well, and ginger. So, those type of things.
So this is lovely, because I'm just going to be asking you to for these recipes, and I'll be putting them all in the description box, and then people can, actually start doing these things that are going to be so helpful to them. Yep. So I have read a lot about sage as a mouthwash. Yep. How does that work?
Well, it is, again, it's an antibacterial, microbial, and an immune booster. That's why you use it for anything, not just hormones, but also because sage is for menopause as well. It's one of the herbs for menopause. But sage is, yes, it's so good, but it's more for bacteria like sore throats and things. But you also, sea salt. You've got sea salt, which is just as well, and a lot of you can add it to your toothpaste as well. If you make your homemade toothpaste, you can use sea salt as well. They're all. It's just your preference, what you prefer. You have to try. It's horses for courses. Not, my taste is, I don't particularly like peppermint, but I do love clove. So, or myrrh, frankincense. They're all things which, this is your choice. What is your go-to?
I like that. There's the choice of flavor, but within that, each of these oils has an important function that they perform. Some people also seem to add bentonite clay to their coconut and sodium bicarb mix. What is the thinking behind that?
Well, both bentonite clay and diatomaceous earth, they are fillers, as in, for example, if you have a cavity or your tooth starts being very sensitive, if you have the bentonite clay or the diatomaceous earth, because they're silica based more than anything else, they help the tooth to remineralize. They stay stuck in that area, but because it's together with various other essential oils, for example, and the coconut oil, it disinfects as well. So what you don't want to do is you don't want to have the tooth remineralize and lock the bacteria in, because that really is horrendous. So you want to have it clean, but also fill it in so that it can stop the infection going further.
So for people who are concerned that their teeth are becoming a bit more on the yellow side as they age, is there something that you can recommend?
I'm going to be really boring. It's oil pulling. I could always tell when my patients started oil pulling or not, because it whitens the teeth as you do it over weeks. It's yeah, so I'm sorry about that. It's oil pulling is also a really, really gentle liver cleanse. It is just really amazing. But apart from that, yes, bicarbonate soda again, just a bit, or sea salt. That's another one. If you can, but you have to make sure it's dissolved so that it doesn't actually abrade your teeth.
Right. Okay. So this, you would dissolve it in water and then just add a little bit of the water.
Yes.
To the paste.
Well, yes, you can do that. Yeah.
Otherwise, it's too abrasive.
It can be. If you've got soft teeth, yes, it can be. But it doesn't have to be. It's again trying.
Alternatively, you're talking about rinsing your mouth with salt water.
Yes.
Okay. All right. Good. Okay. So there are two different ways that we can use salt here. All right. Well, that's interesting.
Yeah.
That's fantastic. Now you've been talking about remineralizing teeth. And so I think this bears a little bit of explanation, because we've been told that if there's a cavity, that's it. It has to be filled. It's not going to heal. So Isabelle, tell us why that's true.
Well, I can tell you, I had cavities, and I did my thing because I know that I have an allergy to mercury and amalgam, and I've found out recently that actually one of my composite fillings has a lot of it in there, despite being composite, which was not, I wasn't really happy about. But so basically you can, with the right mindset and frequency, coming to frequency now, you can regrow your teeth, but you can also remineralize and heal your own cavities. And again, it's oil pulling, it's having your own toothpaste with bicarbonate soda. I tend not to use the bentonite because I'm not quick enough, and it sets really thickly, and and therefore it doesn't really work trying to shove a block around your mouth. So I've just been using bicarb and coconut oil, and the dentist has agreed that by millimeter, the cavities are closing. Wow. Which he's not happy about because he can't charge me for putting fillings in.
Wow. Okay. So he obviously assumes that you must be this miracle of nature, and hasn't quite worked out.
They actually know about this.
They do know. Okay.
Some know. It's just, again, it's a money making process, isn't it? It's they can charge you for putting filling in, but when you do it yourself, they can't, can you? I had to have it. Yeah.
I presume that you're not saying that if somebody has a filling, they should remove it and leave that hole to heal itself over time.
No, I wouldn't do that.
No. I wanted to make sure.
I wouldn't do that, for the simple reason the tooth has already been tampered with, and unless you really know what you're doing, it's not a good idea, because it'll get worse. One of the things, and now going back to root canal, you are essentially, the tooth is dead, but they cannot get everything out of the tooth nerve-wise, so there will always be something else, and the inflammation or the infection will always carry on in that tooth. And then that's why I showed you this picture here. Oops, doing it upside down again. Then you really are having problems, and it doesn't show on the x-ray. It just shows you the dead tooth. It doesn't show you on the x-ray unless you do a CT scan or something, what it does to the jawbone. So you can, I mean, I've had root canal treatment before I knew better, and I've always had problems with those teeth. It's because the infection does stay in the body and kills the tooth off, and then you have necrotic dead tissue in your system. And what does the body do? It tries to either reject it because it, you know, why should it be there? Or it encapsulates it. But in order to encapsulate the root of the tooth, it needs to affect the bone, and it actually softens the bone around that tooth. So it's really not a good idea. Sorry.
Okay, so essentially what you're saying is that when we have a root canal, what we are doing is locking in a state of inflammation into the body, and that is going to have an effect on the bone. But I presume also, because of the connection to organs, or because it's an inflammatory area or an inflamed area, that this could it affect the bloodstream?
Yes, absolutely.
So
and it affects the organ that's related to that tooth.
So essentially, we're in a state of low-grade inflammation, but it's chronic low-grade inflammation, which we know could have an impact on health. And nobody necessarily, when you develop symptoms elsewhere in the body, make a connection to the fact that you've had a root canal.
Exactly.
Okay, well, that is very useful to know. So, okay, alternative to a root canal, if the situation has got to the point where there is no alternative, but because the tooth is not going to heal on its own very easily, I think you're suggesting an extraction would be better. Because you don't have that low-grade inflammation always in your body.
You haven't got the cause of the low-grade inflammation or low-grade infection in the body. You do need some other help to some treatment to go with the extraction in order to clear the body of the toxins, because they're still in the system.
So for people who
the cause is actually, the root cause has been removed.
So let's imagine that we're in a situation where a tooth extraction has just been done. What would you recommend is needed to support the healing process in the body at that point?
A gentle detox.
Okay, such as?
Again, that depends on the person. It depends on the lifestyle, it depends on the person, how it fits together with their lifestyle. I mean, yes, boring. You guess what I'm going to say. Oil pulling.
Of course. Yes.
Also, I mean, obviously castor oil wraps are a bit difficult around the mouth, but certainly I would go for castor oil wraps around the waist, so that you cover the liver, gallbladder and the kidneys, because again, it is a very light detox. And other things that remove, for example, mercury. It's most likely that if you've had a root canal, or you're thinking of a root canal, that it has been filled, the tooth has been filled prior anyway. And then look at where else in the body there may be an issue, because look at the tooth, see where it, which tooth it is and what has the effect in that area.
Okay, well that's great. So for those who have had a tooth extraction and it was a long time ago, is there any need for concern, or is everything healed up nicely?
I don't think everything is healed up nicely. I would go for a detox. make sure that you do a proper detox as best as you can. And have a look at your general health. What issues are there? And then start treating those issues. And then you should be okay. I mean, I was quite shocked this morning, actually, because I don't know whether you've heard of the Genius. It's a frequency machine, and you speak into it and you take a photograph, and then it works out through the frequency of your voice, because every cell has a perfect balance. If it's out of balance, it affects the voice. It affects the way the voice comes out. So just before we came on, I thought, oh, I'll just do that quickly and see what it says about my teeth. Well, I got a shock, I can tell you. But I realized that actually at the moment I'm grinding and clenching so much while I'm sleeping that, I mean, I said to Heather, another CABI member here in Norfolk the other day, I feel I woke up and I've totally rearranged my face. It was that painful. Couldn't even eat soft eggs because I clenched so much. And I can quite happily show you everything that's red is acute. Okay.
Oh, that's everything.
So everything that's red is acute. Everything that is yellow is borderline. Green is okay, but can you see the blue?
Yes.
The blue is chronic.
Oh.
Okay, so I was shocked at what my teeth are doing. So I need to do something. And I will sort it with the frequencies. So it gives you the choice of working with the frequencies, and it tells you how well the frequencies have actually attacked that issue, if you want, and how your body has reacted to it. We are frequency. Every cell in our body has and is a frequency. We're made out of frequency and electricity and magnetism. It's just that we keep forgetting about that, and working with that will help us heal.
Fantastic. Well, do you know what? Our conversation today also will help many people heal. So I want to thank you. And I can see that my instinct to begin with the mouth was a really good one. So
definitely.
I think I'm sure, I think maybe next time we ought to look at the gut and gut health, but it's good that we started with the mouth. Thank you very, very much.
Definitely. Yeah.
And thank you all. Next time, I think we're going to be looking at the gut. And until then, goodbye.
Bye, and thank you.